Dermatophilus congolensis is a gram-positive, aerobic bacterium that is the causative agent of dermatophilosis, also known as rain scald, in animals. This bacterial infection primarily affects sheep and cattle, although it can also affect other animals such as goats, pigs, horses, and dogs. Dermatophilosis is characterized by lesions on the skin that are red and crusted over. The lesions are often found on the animal's back, shoulders, and hindquarters. Dermatophilosis is spread through direct contact with an infected animal or contact with contaminated objects such as brushes or combs. The bacteria can also be spread through airborne contact with infected animals. Most animals recover from dermatophilosis without treatment. However, young animals and those with a weakened immune system may require antibiotics to clear the infection. Treatment for dermatophilosis generally consists of topical antiseptics or antibiotics applied to the affected areas of the skin. In severe cases, systemic antibiotics may be necessary. It is important to note that dermatophilosis is a contagious disease that can be easily spread from animal to animal. Therefore, strict biosecurity measures should be implemented to prevent this disease's spread. In the next segment, Dr. Kamran Ali Chandio will discuss in more detail how this condition affects horses.
Hello everyone, so today we will discuss on topic dermatophilosis in horses, which is presented by Dr. Kamran Chandio. So in this topic we will discuss on what is dermatophilosis, clinical signs, diagnosis, treatment, prevention or control. What is dermatophilosis? May be called rain, mud fever, etc. caused by dermatitis congolensis and characterized by exudation, scab formation, and loss of hair. There may be secondary bacterial infection, example staph. Clinical signs vary with the length of coat, long hair matting, and larger scab formation. Removal of the scab shows a moist, pink skin, which may be raised slightly, have an ovoid shape. In short-haired horses, the scabs are smaller with the hairs embedded in the scab, which is easily pulled freely from the skin with fingers. Around the fetlock, pastern and bulbs of the heels, there is an initial exudate, scab formation and matting of the hair. This can be followed by oedema, cracking with further exudation and oedema and lamellus. Diagnosis: demonstration of decongolensis from fresh lesion is stent, smear or following culture on blood agar. The demonstration of the organism in old or healing lesion is more difficult. Microscope examination of smears stained with methylene blue will show the presence of branching, mycelium-forming organisms. Giem's stain and squash preparation can also be used. Treatment: keep the horse dry, no contact with wet, muddy fields, and keep out of the rain. Remove the debris and wear suitable the scabs using infectant shampoo, example surgical preparation, and apply a 1% potash of alum solution or allow the skin to dry out. When necessary, parenteral antibiotics should be given. Procan penicillin is a drug of choice. Prevention or control: prolonged wet weather exacerbates the condition, in particular in horses kept in muddy fields with no opportunity for the mud on the limbs and body to dry out or be removed. If possible, staple the horse in a dry box. If the horse is prone to mud fever, ensure the bedding is kept dry or remove the bedding for most of the day. Ensure regular good grooming with cleaning of grooming kit and prompt attention to any skin lessons. Thank you to listening and watching us. We will meet again with other interesting topics very soon.